Plano ng Pilipinas na manguna sa Global Solidarity Trial sa paggamit ng virgin coconut oil o VCO bilang posibleng gamot kontra COVID-19. Ito ay matapos ang matagumpay na clinical trials na isinagawa ng Department of Science and Technology, Food and Nutrition Research Institute ukol sa pagiging epektibo ng VCO sa paggamot ng mild cases ng COVID-19. Kaugnay niyan, kausapin natin si Professor Fabian University at kabilang sa FNRI study team. Magandang gabi po sa inyo, Professor Dayrit.
Ay, magandang gabi, Pia.
Yes, well, Professor, how do we go about this? Do you apply to lead the solidarity trials for VCO's use?
Well, it's really modeled after the WHO solidarity trials for drugs. So this is really like an idea or a campaign for VCO. And since I am also the advisor of the international coconut community, I thought that it would be a really fitting campaign to globalize the study on VCO. So like a drug, you don't just do it in one place. You want to do tests in many places around the world. And the international coconut community has about 25 or 30 member countries all over the world. So, yeah, why not globalize the clinical study?
Yes, I understand, Professor Dayrit. My question is, how do we go about this if the Philippines wants to lead the solidarity trial? Is there a process? Is there are there rules that we need to follow for this? Do you apply for this or what?
Oh, basically, each country will run its own trial. The protocol will be shared so that the different countries will replicate the studies in other countries. So, for example, if in the Philippines we generate 300, 400 subjects, patients, other countries generate another 300 or 400. Then by the time you get 5 or 10 countries to do it, then you have thousands of patients, and you can really show under different circumstances whether VCO really works against COVID or not.
In the earlier clinical trials, Professor Dayrit, it seemed like effective ang VCO sa mga mild cases. But would the ano yung possibility of using VCO for severe cases?
Well, that will require another design of a clinical trial. So you have to have these ethics clearances and other things you go through. So there are actually various parameters that you have to follow to do a clinical trial. So you have exclusion criteria, inclusion criteria, etc. So it's quite, there are rules for running clinical trials. Now, to do it on serious cases, certainly that's possible, and that is what the UPPGH is supposed to be doing. So these would be the serious COVID cases.
Dr. Dayrit, what is it in VCO that made it effective, at least in the studies that have been already done against COVID-19? We all know coconut is known as the tree of life. No, is that? Can you explain more?
Well, the fatty acid profile of coconut is well known, and the component fatty acid in coconut oil, which is most active, is lauric acid. That is a 12-carbon fatty acid, and it makes up about 50% of all the fatty acids of coconut oil. And it has been shown, and this is for research that has been done, since the 1970s, that lauric acid is the strongest, most effective antibacterial and antiviral component of coconut oil. So that is really the property of coconut oil that is most prominent. And the coconut oil is unique in the sense that there's no other vegetable oil that has this property.
All right, Professor Fabian Dayrit, thank you very much for joining us tonight. Salamat po, sir.